My research is focusing on anxiety disorders, and anxiety disorders are one of the most prevalent of all mental health illnesses. They affect about 30% of the population, and they are highly costly. So a recent paper came out saying that in the UK, the annual cost of anxiety disorders is £10 billion. Now, one thing that we know about anxiety disorders is that they're twice as likely to occur in women. And despite this, we know very little about why this is the case. And we also don't know how things like sex or sex hormones influences anxiety or influences response to the current treatments that we have for anxiety. And to make matters worse, all of the current treatments that we have been based on models of anxiety that have ignored sex as a potentially important factor. And so what this might mean is that women may not be receiving the most appropriate treatment for anxiety. Now, given that anxiety is so overrepresented in women, it's really important, and we have a responsibility to make sure that women are receiving the most effective evidence-based treatment. And so this is what my project will be looking at. Specifically, I'll be focusing on how sex hormones influence response to treatment in women with specific phobia.
And so what would the impact of that work beyond people who...
So if the results of the study bear out, then what this would suggest is that treatment is affected by hormonal levels, and that in order to optimise treatments for anxiety in women, we would just need to make a few minor modifications to what we're currently doing. So things like being a little bit more sophisticated with how we time the administration of treatment relative to, say, a woman's menstrual cycle, or, you know, dependent on whether she has gone through menopause or is using the contraceptive pill. Or it would mean something like the use of estrogen as a very simple, safe pharmacological adjunct to current psychological treatments.